Hi, Dr. Corey Maas on Looking Your Best. And today I wanted to answer a few questions. One of them came in which was very important, and we're doing a segment, NBC News came out to do an interview today about the so-called Facebook facelift. And the Facebook facelift is apparently a social media driven initiative where folks are coming in and asking for different procedures or interventions to look better, to improve their profile picture or page, and to improve the fact that we're all now in the world of images, media, social media, Facebook, Instagram, Pinterest, you name the list, even Twitter, and we're all exposed to photography and getting our faces posted all over every kind of social network that we can imagine. And the question was, is that right? Is it wrong? And how does it impact our practice? In general, I have not had a patient come in and specifically tell me that they want to get a surgery or an intervention for a social media type of initiative. But with that said, we are all aware now of our faces being out in the public. So what can we do about it? The first things, and I've outlined this before in steps for simple success. Do good skincare. That's something you can do. 3 or 4 special things that are not too complicated. One is to protect your skin. A good sunscreen should have a physical blocking agent. Number 2 is skincare products that we can use. There's only a handful that we know actually work. The retinoids, in particular retin A, are things that you should use daily. Some people have to use lower concentrations. Some people can't even use a retinoid every day, and I'm saying the name retin A, it's tretinoin is the molecule. The third one is vitamin C. Esterized vitamin C clearly has shown antioxidant and beneficial effects in inflammation, making the skin look smoother. And then lastly, of course, is gentle exfoliation, which I think most of us do to some extent or another. And gentle exfoliation doesn't mean you have to go to a high-end spa or salon or even to our practice. You can do this simply at home with a light alpha and beta hydroxy acid wash. Even a buff puff and a good non-detergent cleanser will give you a gentle exfoliation of the skin. So gentle exfoliation, protecting your skin, a retinoid and vitamin C, and you're 90% home on your skincare. I think that's an important concept, and we'll talk a lot more about skincare products as we get into the details, talking about the Maas Clinic skincare line, one that I've developed and worked with 2 compounding pharmacies to put together. So the important thing about skincare, of course, is that you use it. The other small things that you can do are make sure that you're hydrating and make sure that you're getting some exercise. These are all things that don't require patients to come to my office to get and are very important concepts. So in terms of the social media world and how we look, yes, it's an image-driven world, and there's a lot of small things we can do to always stay looking good. Those are a couple of small suggestions for looking your best. So thanks again for listening, and Dr. Maas on Looking Your Best.